Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the Meckel's diverticulum. Meckel's diverticulum is also called Ileal Diverticulum. This is a true diverticulum. And it has all the layers of the intestine and has all the layers of the intestine. Okay. So it is a diverticulum in the ileum. So it is called ileal diverticulum, also called Meckel's diverticulum. So if we go to the ileum, okay, this is the ileum, then it is present in the anti-mesenteric border. There will be a diverticulum and it has all the layers of the intestine, and we have to follow the rule of two. Okay, it is present in 2% population. In 2% population, it is about 2 inches in length. About 2 inches in length. It may contain 2 different type of tissues, different types of tissues, like that of it may contain the gastric mucosa and pancreatic mucosa. It may contain gastric mucosa and pancreatic mucosa. Okay, so it is present in the anti-mesenteric border at the anti-mesenteric border. Okay, so what is Meckel's diverticulum? This is the remnant of the yolk stalk. Okay, this is the remnant of the yolk stalk. Okay, ideally it should disappear. The yolk sac, yolk stalk should disappear by 6th week of intrauterine life, but for some reason it may not disappear. So it may remain like that way, or it may be just independent like that way, or may be connected by fibrous cord to the umbilicus. So it may have fibrous cord to the umbilicus. Okay, or there may be fistula, okay, omphallomesenteric fistula here. Is the umbilicus, and this may be the omphallomesenteric fistula, omphallomesenteric fistula. Okay. May happen. It may be asymptomatic, just small, and there is no communication. It is rarely symptomatic, not always symptomatic. It may be diagnosed at autopsy. Okay, we got that. So we got rule of two. So what are the symptoms of this patient? It is maybe asymptomatic in most cases, but it may show the signs of, most common symptom is that painless bleeding through the stool, painless bleeding through the stool or per annum. Okay, so we get that. And if it is containing the gastric mucosa, there may be chance of peptic ulcer type feature, peptic ulceration, because it contains peptic epithelial cell. There may be features of pancreatitis. Okay, or if it is inflamed, then we may get features of appendicitis. Okay, so it's differential diagnosis. Any other cause of hemorrhage or bleeding in the intestine, there is painless, and also appendicitis. Okay, so we got the symptoms. What might be the possible complication? Possible complication like peptic ulceration, pancreatitis. There may be bulbous intestinal obstruction complication. Possible complication, not always seen it is. Intestinal bulbous leading to obstruction, and it is mostly seen in children. Okay, mostly seen in case of the symptom, mostly seen in children, also in case of male children more than that of the female children. So we have intestinal obstruction. So how can we diagnose? We diagnose by Meckel's scanning, CT scanning or CT scan or ultrasonography. Okay, we got that. Yeah, and what is the treatment? Treatment should be decided by the surgeon, who usually it is dissected out. There is the idea. So that's all about the Meckel's diverticulum, rule of two, symptoms, diagnosis, complications, and that's all for today. So if you like my video, please subscribe my channel, support my channel. Please subscribe me and share the information with your friends. Any question, please let me know. Have a nice day. Bye now.